Yeah, they are.
Daughter,
And yes.
son and daughter.
Yeah,
They're
you're right.
nice people. I'm just kidding. I'm just kidding. Like
Sometimes they know they need a twist in their ears.
we all do. It's part of being human. It's nice to meet you.
Same
Sorry
here.
it's in this
So-
clinic.
so-
I thank you guys for being here.
Thank you.
I know you guys are probably wondering what next steps are. I promise we will address all of that. I don't want to steal Dr. Reynolds' thunder.
All right.
So what I'm going to do is just review a little bit of your history so far and start from there. Is that okay?
Yes.
Okay.
Sure.
Is anything bothering you head to toe today?
Actually, I think because I don't know. You are the professional, of course. I have little bit of, you call it fatigue. You call it bone pain.
Okay. How long's that been going on?
For my knee, it is whenever it's cold,
Okay.
I have this pain.
Have you had that for quite some time?
Yeah.
Okay.
It's very acute
Left
pain.
knee
Yeah.
or right knee?
They are both,
Both?
but this
Okay.
one, while I'm sleeping, I have this like this, you know.
Okay.
I can't stop unless express myself in pain.
Okay.
And
Have you taken any medicine for it?
actually, they gave me back home physiotherapy, but I tend to travel a lot,
Okay.
so there's like stop and continue, and then I stopped. Yeah. I take this. It's like a supplement, Dorifin. Yeah. There's two ingredients there, glycine and ginkgo biloba, like this.
Okay.
Yeah. But still, nothing progress from there.
Okay.
I also have this after the COVID-19 shot. I start to have this also pain, which is like it goes and comes.
Okay.
Yeah, and then it travels sometimes here, sometimes here. And unfortunately, while I was in December in Thailand, I fell a nasty fall, which comes into my face. I cut my lip and I hit my shoulder here. And it's also enhanced
Made things worse.
yeah.
Okay.
Actually, I had to do MRI back home, but it was so suspended until until May. So I had to come here and I didn't do any MRI or anything. Yeah,
Okay.
yeah,
Well, I think sorry to hear all that.
yeah.
I think the good news is I don't think any of these are related to what's going on in the pelvis.
yeah.
I guess from a pelvis standpoint, how did this all get started? Did you have bleeding, cramping, pain?
Yeah, actually, it started April
Okay.
last year.
Okay.
It's like a discharge, like watery. Sometimes becomes like beige color.
Okay.
Sometimes it is pinkish. Sometimes it is blood.
How many pads in a day?
Yeah, like 4,
4. Okay. And then
5.
since April, did it just stay about the same or get worse?
The same.
Same.
Of
Okay.
course, I was so annoyed. I went to the doctor.
Yeah.
The 2 times they said maybe once you take this antibiotic, which is inside, and nothing happened. After that, they said it's better to do ultrasound,
Okay.
which is abdominal.
Yeah.
And also they take a pap smear.
Okay.
Yeah.
Was that normal?
Yeah. Yeah.
Pap smear was normal?
They said nothing.
Okay.
From that, I did an MRI, and it shows that there is a piece of something. They saw.
On the inside of the uterus.
Yeah.
Okay.
They said maybe it is the
IUD.
IUD, yeah.
Okay. So
Uh,
you have an IUD in place right
Yeah,
now? Okay.
when I deliver Haura, my daughter, the last daughter here, I think she was born in 97, six, probably 97 or the same year when she came. I put this antiseptic, and I totally forgot about it.
The IUD's been
The
in place
IUD.
since 97,
Yeah,
roughly? Okay.
yeah. And they in KRC, my back home hospital, they said it is the IOD. And then the doctor, she said we do surgery, and they went in and they took specimen, and it tends to be malignant, and I was so surprised.
So this was
Ooh.
a hysteroscopy, like all from down below.
Yeah.
They put a camera in. Did they take the IUD out?
They didn't find anything because I did endometrial ablation in 2005 when I came to Mayo Clinic for the pituitary tumor.
Okay.
And because, yes, I had bleeding and had big clots coming.
Gotcha.
Yeah.
So that endometrial ablation, I'm guessing, because usually they have to put a device on the inside of the uterus to cook all the tissue to stop the bleeding. They probably took out the IUD at that time. Yeah.
But what my doctor said, Dr. Christine, she said, I'm very surprised that you did endometrial ablation, and it's, as you said, it's cooking there.
Yeah.
And probably melted, but some of the pieces still there.
Yeah, that can happen. It's not perfect, unfortunately.
Yeah. And when they did the surgery for me and they took the specimen or a biopsy,
The biopsy was done during surgery, correct?
Yeah.
They scraped the inside of the uterus. When was that surgery done?
It was done. Either October or November.
Okay.
November.
No, at the end of November I traveled. Maybe early on November.
Okay.
Yeah. And in December, late December, I had an appointment, and they told me the news that I have this issue.
Okay.
And I have to come here as quick as possible so that I won't have any complications in the future.
Yep. That is our plan. All right.
Yeah.
So obviously no one likes to hear that diagnosis, but the ultrasound that you got as well as that CT all suggest that it's all localized, so meaning just in the uterus. All right. And Dr. Reynolds will talk to you a little bit more about next steps, including usually the way we proceed is with surgery to get this taken care of.
All right.
Okay.
Yeah.
I guess in the meantime, today, fevers, chills, any chest pain, difficulties breathing?
She has difficulties breathing.
How so?
We noticed while we're sleeping in the same room that while
Heavy
she's
breathing
sleeping,
at night?
she kind of snores and then stops breathing for a second and then.
Have you ever been diagnosed with sleep apnea?
No.
No? Okay. Not something like urgent, but certainly with your primary care doctor, it's not an uncommon symptom as we all age. And it's actually quite common, but something that might be worth getting worked up for down the road. All right.
Yeah.
It won't affect anything that we do here today.
Okay.
So don't worry. During the daytime, though, any issues with breathing?
Yeah. As my daughter, she said, sometimes suddenly, like out of the blue, I would say, like this.
You gasp for?
Yeah.
Okay.
Sometimes what happened, Mom? I said, I don't know. I stopped breathing, and then suddenly I'm taking my breath back again.
Any nausea, vomiting?
No, nothing.
Belly pain?
No, nothing.
No. Changes in urination or bowel movements?
Oh, yeah. I have constipation.
Okay. How long has that been going on?
Since I came here.
sorry.
Yeah.
Have you tried using stool softeners or anything?
Nothing.
No? Okay.
Yeah.
And then the bleeding discharge, it's been about the same even since they did the biopsy for you?
Yeah. Actually, when I noticed, I had, yes, spots of blood.
Blood. Okay.
After that, when they did the surgery, I'm having a little bit of pinkish tissues,
Okay.
small pieces like this,
Okay.
and the pads are with pinkish color of discharge,
Okay.
but no bleeding.
No red blood.
No,
Just
no,
still
no.
mainly discharge.
Probably before the surgery I had, but yani, that's why I said, what's happening? I'm having these blood spots.
Okay.
Yeah.
Is it okay if we just review your medical history?
Sure.
In our chart, and I always like to review it because sometimes things are not always up to date. I have, he had a history of the pituitary tumor, thyroid nodules.
Removed.
Removed.
Yeah.
Okay, both of those removed with
Yeah.
the surgery.
Yeah.
The pituitary was in 2008. Or no, you had the first one in 2005.
Yes.
And then again in 2008.
Yeah.
Okay. And then the thyroid was in 2023.
Last year, yeah.
Was it 8?
Yeah.
Yeah.
Last year. Okay.
February, yes.
Okay. And then you're taking medicines for the thyroid replacement.
Yeah.
Okay.
I am.
And then high cholesterol, history of depression,
Yeah.
vitamin D was low.
Yeah.
And then you've also had other surgeries to like an abdominoplasty. Is that correct?
Mhm.
Any other abdominal surgeries that we should be aware of?
On.
No. So just
nothing.
I guess these aren't in the abdomen, but everything
Yeah.
else was from down below, from the ablation and I know they placed the coils in the tubes as well. The E-Shore. Does that sound familiar?
Again.
The E-Shore, sometimes they can place coils to prevent any further pregnancies.
What's the issue?
E-Shore, that's the name of the little coils that they'll put in the uterus, in the fallopian tubes from down below.
Yeah, only when I give birth
Or
for my.
بس تعرفين المسار كذي بالضبط ولا؟
I don't know. It's just antiseptic. I don't know. Coil or.
well,
I
it was
don't
probably done at the same time as your ablation.
know.
No. She
Does that sound familiar or no?
No.
No? Okay.
Yeah.
Alright, but otherwise no abdominal surgeries.
Only the ablation and the recent one,
Recent
which was, yeah.
Okay. And then in terms of medications that you take, I have a pretty long list here. So I know a lot of them are supplements, but maybe I'll just read them out. You tell me if it's accurate or
Yeah.
not. It looks like some Tylenol is needed.
Sometimes.
Okay.
And
And then you're taking the cabergoline for the pituitary.
Yeah.
Still on that? Okay.
Yeah.
And then I see vitamin D, calcium, Zetia for the high cholesterol.
Yes.
And then, are you still taking this Dexpanical?
No.
Does that sound familiar?
No.
All right, let me see if it comes up as another name.
Okay.
But you're taking your thyroid hormones.
Yep.
And then pivastatin for the cholesterol as well.
Yes.
Venlafaxine for your mood.
What you call it, doctor?
Venlafaxine, Effexor.
Effexor,
Effexor,
yeah,
okay.
yeah.
And then, it looks like this is a cream, a couple cream supplements.
Yeah,
Okay.
this is because of the dryness of my
Okay.
skin.
No worries.
Yeah.
And then allergies, I just see adhesive to tapes.
Oh, yeah.
Okay. And then prior to this bleeding or discharge last year,
Mhm.
any issues with bleeding after menopause?
No,
Okay.
nothing.
And then anything that runs in the family,
No,
cancer-wise?
No.
Anybody else that you know of?
nothing.
Okay.
Yeah.
And then a few other questions that I ask everyone. Smoking,
No.
drug use, alcohol use?
No.
None of that? Okay. Alright. And then it looks like